Good day, everyone, and welcome to TechBBQ's Life Science Pitch Competition, sponsored by the Novo Nordisk Foundation and in collaboration with Extreme Tech Challenge. My name is Jan, and I serve as the project manager here at TechBBQ for the Life Science initiatives. It is my pleasure to host the Life Science Pitch Competition for the first time here at our dedicated stage and area for life science. We are excited to celebrate innovation and entrepreneurship in the life science industry together with all of you in these 2 days of summit. Today, you will have the opportunity to meet the top 8 startups within life science in the Nordics. Each company will present themselves for 2 minutes of pitch, followed by a 3-minute Q&A session with our esteemed judging panel. We will announce a winner, and that winner is the startup that excels in team, product or service, product market fit, and tech for good. But before we dive into the pitch competition, I would like to introduce and to give you a short introduction and welcome to our partner, Extreme Tech Challenge.
We have many difficult challenges that we are all facing. So what can you do about that using technology?
I am extraordinarily impressed with this program. The Extreme Tech Challenge is an outstanding program for entrepreneurs around the world, and I was incredibly impressed with the energy and passion and overall quality of the companies and entrepreneurs I had a chance to meet.
If you're a founder of a startup, you want to make a real impact and you want to go global, then the best platform you can choose is Extreme Tech Challenge.
You want to mobilize the community of startups as well as corporations.
Many of our generation kind of mess up the planet. You guys might be able to fix it.
All right. And now I'm delighted to introduce to you Victoria Slivkov, the Executive Managing Director of Extreme Tech Challenge and Head of Ecosystem at Walton Catalyst Ventures, for our welcome remarks. Give her a big hand.
Thank you. It's so wonderful to be here at TechBBQ, feeling the amazing energy of the conference. I've had an amazing time reconnecting with old friends and making new ones. So it's really wonderful to be here, and it's great to see familiar faces in the audience. My name is Victoria Slivkov. Extreme Tech Challenge, or XTC, was founded 10 years ago by 2 legendary Silicon Valley investors, Young Sung and Bill Tai. They're investors in some of the most iconic companies that you know today, including Zoom and Canva, that came out of this Extreme Tech Challenge community. From our humble beginnings on Sir Richard Branson's Necker Island, fast forward to today, we are the world's largest marketplace for innovation, attracting thousands of startup founders from over 120 countries globally. Our mission is to find the most promising companies that are working to change the world and give them what we call rocket fuel to help them scale, which include 4 things. First is global visibility, put them on stages like this. Second is access to venture capital investment, as we partner with some of the largest VC firms globally, over 350 official partners and thousands of non-official ones. Third is access to corporate strategic partnerships, and fourth is mentorship. And the power of XTC, as I like to say, it really lies in the strength of this community that help us identify and elevate the most promising companies. Just to say some stats, recent cohorts have raised collectively $4 billion in VC funding, and we've seen dozens of exits in recent years. So that's a real testament to this amazing community, and thank you to the judges, including the judges evaluators today, that have made that happen. I am so happy to be here. You're going to hear from top 8 companies that are driving innovations in life sciences stage at the intersection of tech and bio. So we're going to have a really great program today, including some real thought leadership shared during the fireside panel during judges' deliberation. I really believe in the power of tech innovation entrepreneurship and meaningful capital to build a world that we want to live in today. So thank you so much. I also want to give a shout out to all the founders who applied. You're all winners in your own right, and it's been such a humbling experience to learn about your work and read about your journey. So thank you so much for participating, and have a great event.
Thank you very much, Victoria and Extreme Tech Challenge. Now, at this very important moment in the life science history at TechBBQ, it is essential to recognize all the exceptional individuals who will guide us through this exciting journey today. Some of you might have seen them, they are the people that are running around up here, but I would like to introduce our esteemed judging panel. Firstly, we have Lee Brody, Investment Manager at UCL Technology Fund, Albion VC. Give her a big hand, please. Secondly, we have Camilla Gilbo, Head of Community, DTU Science Park. Charlotte Schøller, Senior Scientific Manager at Novo Nordisk Foundation. Sam Kondo Steffensen, Co-founder of Rethink Values. And last, Signe Ulrik Holm, Consultant at Danish Life Science Cluster. I would also want to extend a special thank you and a round of applause for our round one expert evaluators and semi-final judges. Their expertise and tireless effort in sifting through numerous applications are the reason what we have brought with us today, the cream of the crop for today's stage. Let's give them a big round of applause for their invaluable contributions. Now behind the stage, we have our 8 finalists eagerly waiting to come up here with their remarkable innovations. They have been helped by our 2 pitch trainers, Lisbeth Holt Jørgensen and Anne-Marie Hall, to provide us with a glimpse into their preparation and what is going through their minds right now. Please welcome one of the 2 pitch coaches, an expert in storytelling, and the founder of Amazing Hall, Anne-Marie Hall.
Yeah, thank you. Oh, wow, you're many. Okay, this is going to be really, really exciting. And you have just been so great. I'm now going to talk to the finalists here because it is not an easy task to be able to communicate what you're working on, your passion, what you're doing every single day, and then ask to do it within 2 minutes. Be authentic, be passionate. Make sure that everybody understands what you're saying. That was the task they're getting, and they are nervous, so please bring as much love, and I am all about of love. The ones knowing me knows that's the case, okay? So we root for you, all 8 of you, and you will do so, so well. Lisbeth and I, we've been training them in their story and in their presence on stage, so they were ready for all of this. And guys, you can do it. So take it away.
Thank you very much, Anne-Marie. All right, I think it's time to get this kicking. So without further ado, please join me in extending a warm welcome to our first of 8 finalists. Alkalase enzyme supplement for the alcohol intolerant.
Hi, I'm Mikkel, CEO and co-founder of Alkalase. 540 million East Asians suffer from alcohol intolerance. If they drink, they get symptoms such as headache, nausea, and heavy flushing. And they have an increased risk of getting cancer. Therefore, they can't just go out with their friends. In Alkalase, we are developing a dietary supplement that allows anyone to drink moderately without feeling the effects of alcohol. This allows intolerant people to enjoy their night out. For 40 years, science has known why this intolerance causes symptoms and cancer. In less than 2 years, we have developed an enzyme system that allows us to make an effective supplement for alcohol intolerance. As a supplement, Alkalase will be available in convenience stores and over the counter. we are exploring B2B and B2C models. And in 2026, we will launch Alcolase with a local partner in South Korea, a 1.6 billion euro market. From there, we'll expand to the rest of East Asia for a total addressable market of 107 billion euros. Our team has a background in biomedicine, biotechnology, and 30 years in the life science industry. And together, we are changing global alcohol culture to be safer and more inclusive. If any of you want to be part of this amazing journey, I welcome you to reach out. Thank you for listening.
All right. Thank you very much for that fine presentation. Okay, now it's time for the 3-minute Q&A session. And who of our esteemed judges would like to go first? Would you, Sam? Oh, the handheld mic. Thank you. That helps a lot on the process.
Yes, can you hear me?
All right.
Good. So just a quick question. Does any of you in the team have some kind of OTC experience for OTC markets in Asia?
No, we do not. However, my co-founder recently relocated to South Korea actually to get a network, and we are already talking to potential commercial partners there. Thanks.
Hi.
Hi.
Thank you. You mentioned wanting to do a B2B program and a B2C. So I was just wondering, since they're very different models, how you think about targeting these two different at the same time.
Yeah. So we are still exploring both models. So we're not sure which way we're going yet. So that's why.
Hello. In the times when non-alcoholic beverage is increasing on the markets, can you give us some perspectives on why this is still very much needed?
Yes. So in East Asia, the no and low alcoholic beverage market hasn't really penetrated yet. So when we visited Seoul in February, we went to several bars and restaurants, and basically no one actually served alcohol-free beer, alcohol-free wine. So you're left with water or soda. And we also think this really opens up the opportunity for more people to enjoy in a no-low alcoholic way.
What are the current alternatives for these people?
So today a lot of them use vitamin supplements, so they don't really have a proven effect. But when we talk to people, they say it's better doing something than doing nothing, and we completely agree. Some also take histamines, so antihistamines, to kind of get the flushing a bit down, but it doesn't help with any of the other symptoms. But they will appear less red. Yeah.
Do people require different amounts of this treatment from person to person? Like, how much is the diversity in the population?
So because we're targeting alcohol that you drink, it's more dependent on how much we can actually break down. And our stomachs, of course, they are different from person to person, but we see them more as a reaction vessel than actually. Yeah. So it should be pretty similar for people. Yeah.
Last question.
Is there a sort of process time? I mean, from your taking the medication to the efficiency?
So we are launching the product as either a gel or a liquid shot, and that means that the active, the enzymes are already they're already dissolved, so they should be active pretty much as soon as you ingest it.
All right, thank you very much. Everybody give him a big hand of applause. All right, our second finalist is ready to take the stage, so I'm not going to waste your time, but please welcome SI Fingerprinting, Diagnostic Guidance and Disease Monitoring.
Hello, I represent Team SI, and we want to transform diagnostics. What if we could change What if we could change the fact that the risk of losing people we really care about? 70% of all clinical decisions today are based on a diagnostic result. Each diagnostic or each disease leaves a unique fingerprint, and we can actually measure this. And how? We use biosensors combined with machine learning. More specifically, we have developed a groundbreaking chip that actually amplify a molecular signal which can then be transferred into a fingerprint. This fingerprint we can read using spectroscopy, and we use machine learning together with the measurement for the chip to generate a disease picture which can then be translated into a diagnosis. Most importantly, this allows us to create a disease picture of diseases that are currently difficult to diagnose today. Let's take cancer as an example. Speed is super important when you need to get the diagnosis for cancer. Today, the diagnostic pathway is simply not tailored for that. It takes weeks or more to get a proper result. And people die of this every day. 9 in 10 people would be saved if they had access to early diagnostics. And this is something we want to change. If we add the ASI diagnostic fingerprint to your, let's say, clinician at the hospital or even at your local general practitioner, we will give them a tool that they can fast give you the best diagnostic result possible. More importantly, you don't have to wait because it will also look at some of the diseases that are currently difficult to diagnose today. What we are developing is a true point-of-care platform which enable...
Sorry, but I will have to interrupt you here. The 2 minutes are up. Okay. But thank you very much for that fine presentation. Everybody, please give him a big round of applause and wait up here for Q&A, please. Here. Thank you. All right. So, judges. Sam?
Yeah, my question here is that I'm just wondering about the maturity. I mean, how far are you in proving actually that this is working?
I mean, this is not it's a technology that comes out of Imperial College London and Oxford University from a quite renowned group. So what we have done is to complete, let's say, the initial testing so we know it works. And what we are preparing now is the clinical studies to get it proved of some specific indications.
Hi, diagnostics is notoriously a really difficult space. How are you guys different?
Well, I think we have taken a different approach. We don't look at a specific biomarker, but we're trying to, let's say, revolutionize it by looking at as the body as a whole and the fingerprint a disease will give you in the blood. So that's our approach.
Is it a DNA base, RNA? What is it?
And that's the most common misperception. We basically look at what is in the blood. So it's molecular, not specific RNA or DNA, but basically everything that you will see in a blood sample.
Can you tell us a bit about your team?
Yeah, we have some experts within, I mean, they're actually here, but we have some super good people and experts within nanotechnology, smart materials, and also AI, which is one of the critical components here. And then, of course, we have people that has launched diagnostic tests globally as well, which is new.
Who is doing this routine? Is it the general practitioner doing it, or is it you?
I mean, we will start working with hospitals in order to get the clinic, because it's a new technology that needs to come into the clinic, so they need to learn to do it and accept the results. So they will start, but we do foresee that it will come from the clinic to the general practitioners, in some countries, potentially a private vendor also.
That's it. Any more questions from the jury? Nope. All right. You want? Yeah.
I mean, I'm just curious, you say it's very difficult to make this diagnosis today, but how will the doctor know what to test for in the first place?
That will take into the way you come when you come to your doctor today anyhow, that they will, instead of ordering different biomarker panels, they will basically have different chips they can load and then test for an entire range of diseases.
So I saw it was Raman spectroscopy. So it will measure, it will give you a specific pattern, and you will relate that to specific diseases.
All right, that was it. Thank you very much. Give Pierre a huge hand. All right, our third finalist is ready. Please give a big hand to Brain Capture EEG for the World.
Thank you. My name is Tune Intøler, and I'm the CEO of Brain Capture, a company that aims to bring EEG diagnostics to the world. Healthcare is unequal. Lots of people in the world do not have access to diagnostics they need to get treated for various diseases. This is true mainly because there's a big lack of diagnostic devices and a huge lack of experts, both in the global south and in the west. We are tackling this specifically for the ED diagnostics by providing a low-cost ED machine consisting of an ED cap, an amplifier, a smartphone app, and a cloud solution that builds on the tools of the 21st century, AI, automation, and lots of other good stuff that I forgot right now. Our solution is easy to use, brings access to experts to the clinic, and provides an affordable solution to bring a new diagnostic into a clinic. We sell devices and we sell services. So each time a clinic does an EEG, they will also get a report back from the practitioner. Our team is very strong. We have the AI experts, experts in medtech, and people with knowledge of scaling globally. We're in a super exciting time right now. We have medical approvals, we have money from the EIC to fund our development and regulatory journey, and we are already selling in our first markets in Kenya. Thank you very much.
Thank you, Tue. Right on time. All right, judges. Sam?
Where do you see your primary market for in the initial phase?
So in the initial phase, our first markets are Kenya, and then we're going to expand to similar geographies via distributors, and then take the technology back to Europe and the US once we have matured it further.
And am I right? There's no need for doctors or clinicians when you do this testing, or can nurses also?
Yes, so our solution is designed for nurses to use it easily, so they do not need to hire ED technicians in the clinics.
And it works?
It works.
Okay, thanks.
Yeah, that was going to be my question. How well known is the EEG biomarkers to diagnostic of an indication?
Oh, so they're super well known. This has been used since the 50s for various diseases. Epilepsy is the most common one, but also a lot of other diseases it's used for.
And just on that note, have you validated your technology in Kenya and in the setting outside of a laboratory?
Yes, we're running trials in Kenya. We have a sales team in Kenya. We have sold the first 5 devices with clinics that have signed contracts there with the first customers there.
What's your revenue model?
So the revenue model is twofold. It's the device sales, and then it's the pay-per-use for scans. So when you do a report, it's sent remotely to an expert, and then the report is sent back. We charge for that also.
Is your price point consistent with your target audience?
Yes. Is the short answer to that.
Any more judges?
What's your IP situation?
So, yeah. So we have a patent pending on some of our technology to make this super easy to use. And then our model is very different from traditional device sales. So that we have the full chain of actually doing the recording to providing the report back.
Yeah, I was just wondering, the production of this device today, where's that taking place?
We're producing in Poland at the moment, and some of it is also in China.
Oh. And it works also?
It works. I mean, we are just about to receive the CE approval for this, so it's tested technology. It works. It's approved.
Yeah, fine.
All right. I think this is for the last question. Please give him a big hand. All right. The next competist finalists, please help me welcome Droplet IV, automatic IV line flushing.
Thank you. Hi, my name is Thor. I'm a medical doctor and co-CEO of Droplet IV. 2 years ago, we discovered that 20% of IV medication never reaches patients. This is because the IV line traps medicine and is often thrown out. Think about it for a moment. Everybody in this room will probably need IV medication at some point in their lives. So this means that I, as a medical doctor, cannot provide my patients with the best treatment, getting the full dose. So we invented Droplet IV, a medical device that automatically flushes IV lines. Simply attach it and set nurses free from manually flushing IV lines, which is the current practice. And the market is big, very big. 6 billion infusions are given yearly. Since incorporating 1 year ago, we've had great traction. We have a patent, we won Danish Tech Challenge, we have funding from multiple sources, including the Bioinnovation Institute, and we've been building the team, which now consists of 3 doctors, 2 engineers, 1 business developer, and our latest hire, Mads Marker, who has almost 20 years of experience in the medtech, like regulatory experience. Last but not least, we have validated our product market fit by getting support from key opinion leaders such as the authors of flushing guidelines in the US, UK, and Denmark. We're here today looking for smart money, but also a senior engineer to join our team and help realize the great potential of Droplet IV and bring the best IV treatment to patients. As we always say, medicine belongs in patients, not in the trash. Thank you very much.
The screen, that is just a part of TechBBQ, that sometimes the tech is also not with us. But let's start the Q&A. Sam?
Yeah, thank you. I like the recruitment part. Just which part is actually the IP? What is covered by the IP is one question, and the other one is who's your customer? Is that the hospital or the device makers?
Our customers initially would be the hospitals. We're looking for strategic partnerships in the long run, licensing deals. Our device is this that is in the middle, this bit. You attach it like you would attach any other IV equipment with a spike, port, and we have IV protection for this device, but also to integrate the feature in the existing devices. But right now we had it as an add-on sale. Maybe later we'll integrate it in the bag or the IV set.
No, it might be a bit provocative. You say that medicine doesn't belong in the bin, but couldn't you just adjust the volume to account for the loss?
Yes, you could adjust for the volume to account for the loss. There is a twofold problem. One, you don't do it. It's a hospital. You don't add more medicine to just throw it out. The other is the environmental impact. So when you throw out these lines, they should go in a special bin. They don't always. In some places of the world, they go to a land dump. My co-founder have seen this. Antibiotics seep into the ground and you have increased antibiotic resistance. So it is worth solving. And the solution that you are suggesting, unfortunately, is not viable.
You can say in terms of process risk, you would introducing a new process step, so to speak,
yes,
could increase some infection risk or other risks.
Whenever you add a device, correct, you add a risk of infection, yes. That's a very small risk though. This is a very normal workflow attaching devices like this. You do it every time, multiple times a day for a patient.
Can you tell us a bit more about the customers and what they're saying?
Yeah. So our customers are of course hospitals, but the users which have the big pull, the say in whether they're going to use the device or not. Nurses, we've tested it with more than 50 nurses, and they all have very positive feedback. And this is international feedback. The customers, people who can buy, people who are sitting with budgets, we've also presented to them, and the people who enable sales or buy like sales at hospitals, and they also like the business proposition because there's a cost benefit, a positive cost benefit of adding it. You save on nurse time, and you save on this trash cost, and you improve patient treatment. So we're aiming to be cost neutral to implement, and the administrative people really like that.
What's the price point right now for the type of device?
The price point? It's confidential. But it won't be too far off what is already sold. Like there are special IV sets for flushing, but manual flushing.
And I guess also the green take, I mean, the procurement department likes that part where you're not throwing away medicine.
Yes, they do. And every hospital, at least in the Western world, they have to be more green. They have to care about this. So we see this in Germany, in Holland, in UK, England. Everybody, they're very keen on this aspect.
Thank you very much. Give him a big hand. Okay, we now have our fifth finalist. Please join me in welcome Fauna Smart Technologies, farming systems in line with the nature.
Hello everyone, my name is Dragana and I'm a founder and CEO of Fauna Smart Technologies. We are creating farming in line with nature. Did you know that the farming is the biggest and oldest industry in the world? 20% of the world population works in farming and 80% of the food we eat comes from the primary food production that is ready to be disrupted. You see, the EU regulations are banning chemical pesticides. And this is affecting over 10.5 million farmers across Europe, since now they're transitioning from chemical pesticides to alternatives called biopesticides. And this transition is not easy, which is why we are building a prediction platform for pests and diseases in orchards and vineyards to help farmers understand what is happening in their field and why. Solution is based on a combination of satellite imagery, AI, and horticulture science, which is science about optimal fruit growth. We're offering basic insights for free and premium for 100 euros per hectare. Europe alone has over 600,000 hectares dedicated to apple orchards. This means we are staring at over 60 million euros potential for our business, and we plan to scale to other fruits and vineyards. Our credentials: successful adaptation trials across 3 countries, and financial support from the European Space Agency already 3 years in a row. We are a team of dedicated seasoned professionals, combining academia and industry. And while we are looking at the future, we're also opening doors for visionary investors. If you would like to be part of this revolutionary wave, let's talk more. Thank you.
Thank you very much, Dragana. And I can assure you, you're not missing any slides. They're just a bit smaller than I would like to. All right, let's hear it from the judges. Charlotte?
Are you selling this product now?
This product is actually co-designed with farmers, so they're actually co-investing. So yes, it's also they are investing into developing it, but it's not fully ready. Yes.
Okay. Still testing.
Yes.
And just to understand, you're using AI technology, and that is on a specific crop. So every time you have a new crop, you need to have a new algorithm.
So basically it's like this, when you use, so it's about canopy systems. So you grow apples just like you grow vineyards. So that's how it is. And that's actually like if you actually nail apple orchards, which is the toughest system, then it's easier to go to pears, which is 80% of what is happening in apples. 80% of it is pears, then peaches, cherries. So actually, and then going into vineyards. So it's actually about nailing canopy systems.
I'm just wondering if there's any data sets like this that exist already.
In what sense, data sets that exist already?
Well, this kind of like what's your competition? Have people kind of done this before?
Yeah. So basically, like there's a lot of these type of solutions that you see in arable crops, but it's very different when you grow wheat, barley, rice. Then top view matters the most. You can see these patterns when it comes to pests and diseases, but canopy is the toughest. And there, like although it looks like it's a top-down approach with satellite imagery, it's always bottom-up. So it's us as horticultural scientists that we actually design the knowledge database, and we guide our tech team what to look and when and how much data to throw. What we could see in the current tech ecosystem, tech people are building for tech. And that's like we're throwing petabytes of data. But you don't need to be throwing petabytes of data all the time and every time. You need to know when, why, and what is the cost benefit for the farmer. But all this is important for multinational companies to understand what is the efficiency of their products and how to innovate their R&D strategies.
Are you thinking this is going to be more of a B2B or B2C?
B2B.
So you are sort of having a different system than for row crops, but in a more expensive segment, you could say.
Yes, yes, exactly. Because we could see, like during COVID, we were not lacking bread or pasta. You know, there's always digital systems already in arable crops. What we are lacking is actually innovation here. And that's high value crops that, you know, we get immunity from grapes, from tomatoes, from apples, from pears, but not from bread and pasta. So this is where innovation is lacking. And it needs to come from the bottom up.
Thank you very much, Marlene, for that. Please give her a huge round of applause. Our next finalist is ready. He's right here with me. Please, a round of applause for Hato, AI-powered cardiac analysis.
This is a 12-lead ECG. It is used for manual interpretation of cardiovascular disease, and it even includes an automated suggestion. This is me analyzing an ECG of a patient. This patient is one out of the 3 that are initially misdiagnosed with heart failure. My colleagues, his family doctor and I didn't catch his cardiac attack. Why? Because we as non-specialized healthcare professionals simply have difficulty interpreting the data. And because only 2% of us trust the automated suggestion. That is why we have created a solution that will support all healthcare professionals with early detection, accurate diagnostics, and increased prevention. And the solution is called Hato. Hato is a medical device that will change the way we deal with detection of cardiovascular disease. We utilize the already existing data and employs it with our deep learning models for a more precise real-time diagnostic suggestion. Then, using our web-based platform Hato Hub, we will optimize workflows by using real-time data sharing and teleconsultations. Hato was founded in the beginning of 2021, and we are proud to show that we have already gained a lot of traction. We're currently working alongside of clinical partners in order to implement our solution for research, and we expect our preclinical study to launch this year. I'm not doing it alone. With me, I have a passionate team that consists of healthcare professionals, researchers, regulatory affairs specialists, and a strong technical team. We are seeking 400,000 euros in order to continue our hard work. Please visit us in the life science area.
All right, very nice. Thank you very much. Let's hear it for Sam.
Yeah, thank you for the presentation. I have a question regarding the competition in that field here.
Yeah.
I mean, how is that looking?
So of course it's competitive, but where we differ from our competitors is that we are focusing on the diagnostic part of ECG. So we are focusing on 12-lead ECG, and usually when we look at our competitors, they focus on implementing AI for holder monitoring, which is more like a day-to-day analysis. But this is a solution that will increase the early detection of diagnostics, because we focus on 12 leads, and the 12 leads is what we use in the ambulances, in the general practitioners, all over the healthcare systems for saying what is wrong with the patients here and now. So that's where we differ.
Okay. Your approach, does that have any sort of impact on your sales strategy?
So yeah, yes and no. Let me say it this way. So we have a lot of opportunities out there in the market, but we have chosen a sales strategy where we're focusing, or at least a go-to-market strategy where we're focusing on the general practitioner in the beginning, because we see a huge potential and a huge need in the family doctor setting. But when we have implemented our solutions there, it will be obvious for us to go to in-hospital and to sell this for the cardiological ward and all of that as a combination. But it's two different pricing models and two different business models.
Right.
Yeah.
Thanks.
Where is the problem now? Is it the people trying to interpret the readout, or is there a sensitivity issue? Or because if you give it to a cardiologist versus an EMT, is it just a training difference?
So there's many parts of this. Of course, the problem lies within that we are simply not good enough interpreting the data, meaning that we are picking the wrong decisions. So with that said, people are getting unnecessarily referred to the hospital. Many chronic illnesses, chronic heart patients are going in and out of the hospital, which costs around, at least here in Denmark, 700,000 euros annually. So if we can just help them in the support of saying, this patient has to go to the hospital now, or this patient can actually stay at home, well, then we could actually, let's say, we can hopefully decrease the costs of the readmissions at least. So, again, there's a lot of, it depends on the case, because the general practitioner has more like a problem with the sharing of the data, but again, it's a nurse who look at the ECG. It's not a specialized cardiologist. So it depends on the user case.
Very quick last question. No? Are you sure?
I said everything.
All right. Thank you very much. Give him a big hand. Now we're almost done, but we still need 2 more finalists. The next one is Pharmista Technology, reusable detection technology for rapid diagnostics.
Is it the green one? The green one? Okay, hi everyone. Women have used pregnancy tests for decades. The problem is that on the market there are only single-use options available, being expensive per use and difficult to interpret. This doesn't make sense, considering that the average woman aspiring to become pregnant has purchased 24 tests during the last year. And on top of that, pregnancy tests is the most commonly used over-the-counter test in the world, with a market value of $1.5 billion. We at Pharmista Technologies want to take advantage of this underserved market by developing the world's first reusable pregnancy test, comprising of a monitor and refillable strips, similarly to the razor and blade model, which enables then a hygienic solution and a financially stable solution. According to 90% of women, our solution will increase convenience levels, eliminate the risk of misinterpretation, as the readouts will occur digitally, and lastly, reduce their consumption of single-use hazardous plastic products. Once we reach proof of concept, our plan is to employ the same patented technology onto other diagnostic areas where reusability would be advantageous, and therefore not only disrupt the pregnancy testing market, but the immunoassay market as a whole, making rapid diagnostics, reusable rapid diagnostics, the new standard. My name is Alice, and I am the CEO and founder of Pharmista, with a background in sustainability and business development. With me on this journey, I have my co-founder Rob, who has entrepreneurial experience from building successful diagnostic companies as well as developing them. Now we are raising a pre-seed round of 500,000 euros in order to accelerate the development, as well as initiating strategic collaborations with the area. So if you're interested in knowing more, please reach out, and thank you for listening.
Thank you, Alice. Thank you very much for that fine presentation. All right, judges.
Thank you, Alice. How is your technology different from the pregnancy tests we have now, and why are they better?
Yes, so currently you're using antibodies to detect ACG, and the strip is coated with the technology. But our technology is actually located in the monitor, which I showed, where we place a sensor that's reusable, and then you refill the monitor with strips for each new test.
So what will the price be like compared to the disposable tests?
Good question. So we've priced the monitor with 3 strips as a starter pack for 35 euros. And then when you're in need of refillables, you purchase them in packs of 8 for 20 euros. Based on that, we're 50% cheaper than Clearblue's tests.
I'm curious about your research and how this will be adopted, because I'm thinking a lot of women today, when they buy one pregnancy test, they're hoping they're not going to buy more. So will women happily buy 5 up front and
What we've seen with women trying to become pregnant but struggling a bit is that they purchase packs of pregnancy tests, and when they do a test that's negative, they usually take 3 to 4 more just to confirm that negative. So there's not a rational behavior behind this, but we see that they are consuming a lot of these, especially women trying to conceive.
What's the shelf life?
We are not yet evaluating the shelf life, but we know that our technology itself has a longer shelf life than antibodies. So we're aiming for a shelf life of 5 years, which should be reasonable.
So it's not antibodies. What are you testing?
We're using molecularly imprinted polymers, which are synthetically produced antibodies.
And is the sensitivity level comparable?
Yeah, we've actually done sensitivity studies already, and it seems to be more sensitive than antibodies. And we're going to evaluate cross-reactivity in the next weeks.
Thank you very much, Alice. All right, this is exciting. This is our last and 8th finalist for today. Please give a huge hand to CETA Diagnostics, non-intrusive long-term monitoring of middle ear health.
Hi everyone, I'm Danny, and I'm excited to share with you a novel solution to a surprisingly large yet overlooked problem. Did you know that 80% of all middle ear disease is caused by a permanent inability to equalize the middle ear pressure? Perhaps you have experienced it shortly when flying. It can be extremely uncomfortable and very painful. Every year it affects 400 million people, and untreated it can lead to permanent hearing loss and even be fatal. Diagnosing it today could take years. We've developed an innovative in-ear headpiece that monitors the middle ear health. And with just one examination, we generate a clinical report enabling doctors to either confirm or dismiss the diagnosis. In short, we're the difference between a simple treatment and a lifelong hearing aid. The patient takes home the device and uses it as any other earphone, streaming music or video. And returning to the doctor, they generate a report and initiate treatment promptly if needed. The need has been validated with leading experts in the field, and our calculations show a massive increase in diagnostic speed of 150% and a decrease in costs. Even though we just started this spring, we already have a patent pending, and we have pre-order interest. We have assembled a strong team with technical, regulatory, and management skills, and we plan to enter the market in late 2025. We're racing that right now, and we would like to talk to you and show more about what we have done so far, and more about the surprising magnitude of this, until today, overlooked problem. Thank you.
Thank you very much, Danny.
You're welcome.
All right, judges, last one.
What are you actually measuring?
Changes in the middle ear pressure.
Pressure difference,
Yeah.
okay. And how do you treat that?
It could be with an ear tube or balloon dilation. That's a typical treatment. Yeah.
Who will be your primary customers? I mean, how are you supposed to sell the product? Or
It's a B2B business model,
All right.
and we're selling directly to ENTs.
Okay.
Beachhead market in Germany.
Is a demand for changing behaviors with the doctors and the clinicians and so on? I mean, do they need some sort of education to?
No, regarding the treatment, they know what to do, but what they need is a diagnostic tool.
Yeah, okay.
So the process from patient entering to diagnosis today is just simply too long. It could take years for children, and for adults it could be 2 to 5 years without any need.
Okay.
Yeah.
When you say it can even be fatal, are you talking about middle ear infections or?
Yeah, going to the brain.
Not just,
it's not something that happens in Europe, but in some African countries or South African countries, South American countries, it could happen. Children die from this.
And it can't be diagnosed any other way, just from the discomfort in the ear?
When diagnosing it today, it's sort of a trash can diagnosis. So you go to the doctor and then he says, okay, it's not this, this. And that's what takes the time. And all the while, you get worse. And sometimes you, unfortunately, end up dying.
Have you done any usability testing? Couldn't you set it in wrong or?
Again?
Have you done any usability testing? One thing is the doctor doing it, but you're doing it yourself at home.
Yeah. Actually, we have it right here. So we're doing it every day. We're analyzing on the signal over and over again. What we're looking for, it has a duration of 500 milliseconds. And it's a really small amplitude change. So you have to look very carefully, and we're in that process right now.
And when will this be ready for sale?
Late 2025.
I was curious about two questions, about IP and also price point.
Yeah, what about IP?
That kind of IP you might have, and
Yeah.
then
We have priority date this June, so we're patent pending. We expect EPO to get back to us end of this year, and then we'll see how it goes. You know that the drill, it will take some time. And the other question?
price point, how much?
500 euro setup fee, 70 a month subscription.
All right. Thank you very much.
Welcome.
Give me a huge hand. All right. Huge thank to all of our 8 finalists for the interesting and inspiring pitches. Let's give them an extra round of applause. Now our 5 judges will leave to evaluate and select the winner of the Life Science Pitch Competition here at TechBBQ. And while we do that, we have an exciting live fireside chat planned for you. We'll delve into the topic of what investors want and gain insights from a life science investor. So please join me in welcoming Markus Remmers, partner at Novo Holdings, and Christian Vast, business accelerator and investment manager at Accelerace.
Do you prefer to sit or stand? Or stand?
I think it's probably easier.
Okay. Then it's more like a fireside chat for
Yep.
all of us.
Exactly.
So now we have 15 minutes to really dive into what investors really want and get the insights from you. But first, before we go into the questions, maybe I should add that we in Accelerace have been running a mentor network for life science startups in the Nordics for the past 8 years. So we have about 80 companies that have been through the program. So we have experienced and seen all the struggle that companies have raising funding. A lot of them have succeeded, fortunately, but for all of them it's been a struggle in some way. So I'm really looking forward to get the insights. But first, maybe understand a little bit more about what who Novo is as an investor.
Yeah, thanks. First of all, Novo is a large family. Novo Holdings is the unit that manages the endowment of the Novo Nordisk Foundation. Charlotte was here introducing it this morning. So the largest portfolio company is, of course, Novo Nordisk, but we also have about 160 portfolio companies in the space primarily of human health. And about 5 years ago, we started thinking it's wonderful that everybody's healthy, but what's the point of everybody being healthy if we don't have a healthy planet to live in? So we started to invest in planetary health as well. We like to see ourselves as engaged investors, so we'd like to bring not only our capital, but also our expertise, our background, and our networks to make the companies successful that we work with.
So within, so you expanded now the range of investments. So within life sciences, you are mostly focused on biotech, or how is it within life science specific area?
So it's primarily healthcare. So that's the classical therapeutic areas, including also medtech, hospitals, diagnostics. And then next to the healthcare part is what we call planetary health. That would include food tech, ag tech, green materials, as well as climate tech. And we just announced next week, we're very excited about this, an investment in a Danish company in the space of water, which is our second investment in the water space.
Okay, fantastic. So I guess there are some people here representing companies that would like to raise funding. So maybe dive straight into it and ask, how does a company, a startup, makes themselves attractive for you as an investor? What should they do?
I think as an investor, there's always the big three what you look first when you look at a pitch deck. That's the customer and the market perspective, the technology, and the team. And these three, I think, are the core parts that I would look into every deck. I think what we see often is that companies push technology, and what I'd like to see is more pull from a customer. So the market angle is perhaps one of the, particularly in the early stage, things that get underestimated a lot, but that's certainly something where I would start and then work backwards from there. What I've seen a lot is companies that have a wonderful aspirin that is looking for a headache, and that's wonderful, but it's typically not something that works very well.
Okay, and how many slide decks, just out of curiosity, how many slide decks, pitch decks do you receive per week or per day?
So I think as Novo, in our group, we've received something like 300 or so pitch decks this year to date, so it's quite a few, which means that if you look at it, you have to be pretty efficient in working through it. So it's probably 5 to 10 minutes that the partner takes initially to see does it really fit our focus, does it make sense to go ahead, or is it somewhat outside our investment focus?
So any tips and tricks of what startups needs to do to really make you look at it one extra time, or maybe spend 5-10 more minutes on the slide deck?
I think the first part is stick to the fundamentals. I mean, it's great to be different, but what I'm looking for in a pitch deck is really, again, the market perspective, the technology perspective, the classicals, whereas the IP, what are we going to do with the money? These core questions need to be addressed, otherwise it's very difficult to make up the mind. I would say it's seducing to talk about sustainability and about the big things that everybody wants here, but I would stay away from generalities and try to be true to myself and understand what my company makes better than anybody else in the world. That's really what I'm curious and what I want to be excited about.
Great. So what we hear, at least from the startups, is that what startups consider to be a fast process is often quite different from what an investor perceives to be a fast process. So could you elaborate a little bit on why it's taking so long in the startup's perspective, at least?
Yeah, that's an interesting one. I would say when you begin to work with an investor, I would see this as a marriage. It's not a one-night stand. It's really something where you want to work together for a long while, and it just takes time for investors to fall in love with startup companies. So sometimes when you meet somebody on a dating platform, you fall in love immediately, and then you know this is the love of my life, and you invest. But the reality is more that you grow to each other. You get to know the team. You develop trust. Are they really saying what they do and do what they say? And that's a process that, in our case, can take years. I mean, there's many companies that we're really excited about that we want to partner with, but it's just not the right moment. They're not raising capital, or it's too small, or they're on the wrong phase. But then, at the right moment, things happen. So my advice would be, if you think about raising funds, it's not something that you start now and then you end in 3 months. It's an ongoing process where you build networks, where you meet people, you make yourself known, you establish yourself as a trusted partner, and then when the moment comes, it's going to be a much more natural process to say, hey, how do we get together on this?
So knowing this, that you as an investor would like to follow the company for a while to see what's happening, are they delivering on what they say they would deliver on, and so forth. So on a low practical level, what should they do? So they should send a pitch deck and say, hey, do you want to follow us for a while? Or what do the good companies do?
I'd say the majority of the deals that we actually end up signing come in through networks. I mean, there's some with cold approach. Being here, of course, is fantastic, and there's a lot of opportunity to meet people. But a lot come through trusted networks. So the three advice would be network. Identify the investors that are active in the space that you specifically cover. Get to know them, find out who they are, what they're really interested in, and then begin to build those relationships. And then I think don't try to be too hard to be somebody that you're not. I think stick to who you are. That's probably the best recipe.
So essentially, you would like others to validate the case when you talk about networks, that you would like have other people to have said, okay, this is an interesting case, or what do you mean by networks? What is...
So if I have somebody that I know and that I've worked with and that I know has a good sense of judgment, and he says, hey Marcus, there's this company XYZ, this could be something that you're interested in, then of course it's going to be much easier for me, and I look at it with a different perspective as if I get a call from somebody that I never met, says, we've got XYZ, and then I will have to be much clearer in my critical assessment of, is the technology really working as this done before? What's the differentiating factor?
So essentially what you are suggesting here is to participate in events like this, attend incubator, accelerator programs, BII in the case of also
I think there's
Novo Nordisk
fantastic ways to tap into this network. BII is a great one, incubators, accelerators. In the network of entrepreneurs, I think there's a lot of value that can be created by just being in touch with each other and exchanging thoughts on what worked and what didn't work, who to work with. The world of investors is large, it's growing by the day. There's 1 million people that have the intention to invest, but they may be looking for companies that fit their profile, and they're not particularly effective in looking. So again, the more you build your network, the more likely it is that you'll run into the one person that is the best fit for you.
Great. And by the way, I forgot to mention that initially we would like to open up for some questions from you guys. So it's what you are really contemplating of questions. So if you have any, raise your hand. Otherwise, I have tons of questions still. Michael has the microphone if anybody needs it. So just raise your hand if you want to pose a question. Otherwise, maybe I can, while people are thinking about if they have a question or not, ask. So talking about this validation from network, from people you trust and so forth, to what extent do you look at the board of directors, the advisory board, whatever the setup around the company is?
Yeah, that's a very good point. We certainly, as I said, the team is a core component. If I have the choice in investing in a company where I'm excited about the team with a mediocre idea, or a company that has a fantastic idea but a poor team, I will always take the one with a great team. Why would that be the case? Because if the team is really so great, they'll figure out a way to make the mediocre idea better and find a market entrance to monetize it. Whereas a mediocre team will find a way to screw up a fantastic idea. So the team really is something that, especially in early stage companies, that carries a lot of weight. And it's also having a mix of people that have been around this block a couple of times, particularly in a scientific advisory board or in a board, makes a world of a difference. I mean, if you've got a lot of young people that are excited and run, just one person that has 20 years experience can say, look, there's 10 options here, why don't we try this and this before? That has the potential to save you 80% of your resources that go into things that don't work. So I'd be looking for people on the board that are either part of reputable investors or of academics or industrial experienced silverbacks that I know will infuse a sense of a direction that complements the energy that I want to see in a startup team.
Fantastic. And then a little bit of a tricky question, because having a great team is an intangible thing to some extent, right? So how do you appear, and how is a team great? What are the elements that you're looking for when people walk in the door, or how they appear on the slide deck, or what is it that you're looking for?
Yeah, it's a bit of a fine line. On the one hand, I would really want to see the energy, the can-do attitude, the passion, the spark in the eye of saying that we'll do something that nobody else has ever done before, paired with a bit of a sense of realism. It's great to shoot for the stars or for the moon, but if it's like totally outlandish, then it's probably a little bit too far. So striking this balance, I think, is an interesting one. While staying true to yourself. And if I want to see something a little bit authentic, as opposed to something where I feel somebody's putting on a show to me to represent something that's not real. So that's the how component. And as far as the what component is concerned, I think it's again fundamentals, technology, market access, IP, and everything around it that would have to be solid.
So now, getting insights from you as an investor, what happens when a team that have been pitching to you in a physical meeting, what happens when they leave the room? What are the main things that you discuss often?
I think you get a sense very quickly about the energy and the team, the dynamic, and the fit of the technology. And that's kind of a muscle that over time grows and you get a sense for is the chemistry there among the team? Do these people really enjoy doing something together and doing something special? And is the chemistry also there with the investor or not? And then put this on top of the fundamentals. Maybe have a step back on the team. I heard a really interesting talk from the CTO of SpaceX at one point, and he said the success formula of SpaceX for the mix of teams is they have 20% what he called silverbacks, people that have been flying to the moon for the last 30 years in NASA, 40% top graduates from the schools where you study spaceflight, and 40% of young wild people with a total diverse background, English, philosophy, and what have you. So I think the mix of diversity versus specialty, as well as the infusion of deep experience in this space, I think that's a pretty magic formula that I'd be looking for.
So if there are any questions, please raise your hand and feel free to pose a question.
Hi, you said that you often take kind of quite an active mentorship or strategic guidance role with Novo Holdings. What does that process typically look like?
Can be very, very different. I think typically the first thing that often happens is that we see one company, and as we get a little deeper into the issues, we find that maybe they have an expression platform that doesn't have the potential to get to the cost of goods that are required. And that would be a way where we look into our portfolio of other companies, and we'd like to build portfolios where companies can feed on each other and say, hey, you should probably talk to this company because they have a technology that helps you. And there are a lot of examples where that happened. B, people. So we look at, is the team complete, or are we having a void in a certain expertise that is critical, but it may be a blind spot for the company if you're in it every day and you don't necessarily see it. But then an outside perspective can be very helpful to say, maybe you really need to build more expertise in this space. And by the way, I know somebody who either can do this or who's got an amazing network, and that in itself, I think, is very, very important. And then thirdly, it's also general opening doors and networks when it comes to attracting public funding from the EU, connections to other investors, where the brand name Novo frankly carries a lot of weight. You say, hey, we've got a company, you really should be talking to this team, they're fantastic. That's opening the door. You would have to go through the door and prove yourself, but just that door opening, particularly in early stage companies where everything is new and you have to build everything, can go a long way.
Time for a few more questions, if there is anybody else that has a question. Otherwise, then there is one.
This is rather my take than a question, but whenever I hear about the criteria of choosing somebody to invest in, it's always networking. The answer is, and then I was wondering why, and then I think the answer is some kind of like both biology and then also network effect. That's what's driving most of the incubator.
But maybe can I ask? So why is it? Why the question is, why do you pay so much emphasis on networks?
Again, I think it's building trust. It just makes things much more effective if you can rely on what other people do. We have a lot of conversations with other investors where on a monthly basis we just exchange, what do you think is an investable theme? How do you see these developments that we see in politics and in economy, in the startup world? Where do you see the money flowing? What are hot themes? What has worked for you? What hasn't? In these conversations, there's a lot of experience that flows, and that builds the trust, I think, to then build on this when a company comes where you understand how people think and how they fit together.
Great. Maybe you had a follow-up question, or it was just to pose the questions to Marcus over here.
Hi, I was just wondering if the aftermath of COVID and the current economic climate has impacted your investing at Novo Holdings at all, or in what type of companies you tend to look for, or the geographic location that you've been investigating for investing in? in any way?
COVID really has not impacted us very much. We've continued to deploy capital, and the good news for Novo Holdings is we don't have, we have one LP, that's the foundation, so we don't owe anybody anything. It's all balance sheet investing. We can choose to deploy as much capital and keep it engaged for as long as we want. We don't have to pay anything to anybody at a certain time. That gives us a lot of flexibility, of course, which is great. I will say in the last year, though, not necessarily associated with COVID, but more the Ukraine war, associated energy prices has led to a total drying up of the funding. So we see this in all the statistics, which leads to a lot of companies startups being in distress. And that's this curious situation now that you've got a bit of a negative inflation where the prices are falling because companies are in distress on the one side. On the other hand, you've got enormous amounts of dry powder sitting there wanting to get engaged and investors needing to earn a return on this. But as long as the prices are falling, nobody wants to be the first to make the move. So I expect at the beginning of next year, we'll see this beginning to get a little more normal, but that's a bit of a curious situation that we're in now. Which for us as Novo Holdings is fantastic because at this time a lot of companies call us and we're excited that otherwise probably would not have been talking to us.
Also from my side, on a more low practical level again, so when companies approach you and send you a slide deck, do you prefer that they make a suggested valuation and the round they're raising, how much money they're raising, and so forth, or how do you go about it as a company?
So the valuation is something that we'd love to know, but there's also databases like PitchBook where you go by default, say who are these people, how much money has been invested, how large are they, where do they stand, and typically at some point you will ask, what's your view on valuation? Certainly round size and syndication is another important part. So who else is around the table? And who would be working with. Other than that, I think that's kind of the second step. The first step is really am I really inspired by this company? Do I feel this is somebody that I work with and somebody that I think that can be big? And then the financials is kind of the aftermath. We say, okay, how does that whole thing fit?
So regarding the syndication, sometimes we've seen also for larger rounds actually that everything from the company perspective is coming together. So let's say there are 3 investors that want to join the round, and then maybe last minute one of them says, we don't want to join anyway. Maybe for other reasons than the company. It could be from the fund's perspective, the strategy has changed or whatever. So how do you best manage this with the syndication and investors talking together, and what can companies do to make that process as smooth as possible?
That's a good question. I mean, I'd say the tricky period is probably the early days when it's still somewhat fluid. The question of valuation is still being discussed, and the question of how does it all fit together. But nobody's in the business of investing a lot of time in evaluating and doing due diligence. And then the more time you've invested, the higher the hurdles to walk away. So I'd say syndicates probably fall apart more in the early stage. By the time you're all convinced that this is a good thing, then it's rare that in the last minute the thing blows up. But I mean, it ain't over until the fat lady sings, as they say. So everything can happen.
Right.
And it's difficult for the company at this stage to do anything in a specific way. I think good communication is probably the best advice.
Great. Were there any other questions? Otherwise, maybe to end the Q&A here on a higher note. So, is it possible to raise money as a company?
It is certainly possible to raise money. One thing that we haven't discussed about, and certainly being here in this inspiring context, is the aspect of sustainability and decision taking. I think that's one thing. Typically, there's the 3 criteria, which also, by the way, the 3 criteria of the judges that are discussing now, but there's the 4th of the sustainability. And that's something that, as an investor, we'd certainly look for, but then be very mindful of that is this really an impact that we're making, or is this just greenwashing? And that's a very fine line, and I'd be careful not to jump into the whole and tell a story that's not really substantiated. It's a great opportunity, but you really have to be sincere about it. And is it possible to raise funds? Of course it is. As I just said, I think there's an enormous amount of investors here, and a lot of people that I think see in the medical space, but also specifically in the bioindustrial space, enormous opportunity, because technology has evolved so fast in the last years, and it simply didn't have time to translate into products that make a difference to customers. But the potential, I'd say, is fantastic, and combine this with all the aspects that we see from climate change and political support, with different ways of funding to become available. I think that's definitely a great opportunity there.
So the timing is good to raise money if you also have the sustainability aspect to your business.
Yeah, I wouldn't say it's the best time to raise money, but so I say, but maybe early next year will make it better. But it certainly is the right moment to start thinking about it and to put your name out there if that's what you're thinking over the next 6 to 12 months. Absolutely, yes.
Great. Thank you very much for the insights from you as an investor to a lot of. I think we covered a lot of the aspects, so I certainly learned a lot. So thank you very much, and good luck to the contestants.
Thanks very much. Pleasure to be here. Thank you.
Okay, thank you very much, Markus and Christian. Please give them one last big hand. All right, now it's time to welcome back our judges. They have been evaluating, and now we are preparing to announce the winner. But before we do that, I would like to ask Lee Brody to join me at stage for some remarks why they have chosen the winner. Give her a big hand. Oh yeah.
Hi, I've been lucky enough to be nominated to come say something on behalf of the judges before we announce the big winner. Just to take a minute and thank you for everyone who participated. It was a very difficult decision, and we think every single team did a really fantastic job. So we're really excited about the innovation we saw today. And just a thank you to anyone who participated in the competition itself. And even if you didn't get nominated on the stage or won today, keep it up. This is a really important space to be in, and these innovations are definitely going to change the needle for technologies of tomorrow. So thank you.
Thank you, Lee. And now to help me to announce the winner, please welcome once again Victoria Slivka from Extreme Tech Challenge.
Let's have our check. It was such a difficult decision, but it is my pleasure to be here. I welcome everybody to participate in future Extreme Tech Challenges. Connect with me on LinkedIn. We're coming to the next conference near you. And if you're an investor in the audience, we love you to be involved in our evaluation committee as well as mentors. So with that said, before we announce, this is something we do for fun at every conference. I'm going to turn around and let's do a group selfie so we can involve everybody in this process. So hang on. All right, Yen, come join me.
Sure.
Let's get everybody in here and do a group selfie.
All right.
All right, super fun. And the winner is SI Bioinnovation Institute. Come on up. Congratulations. Woohoo. And we have flowers. Anne-Marie's going to come. And the trophy?
Yep, I have it all.
Okay.
I'm lacking arms.
Oh, this is an awesome looking trophy. Congratulations, pair. This is such an amazing recognition. Here's the trophy. Yeah. Oh, okay. Awesome. Okay, let's get you on the other side.
Is that okay?
Yeah.
Let's get the team to the stage.
Yeah, let's also get all the founders today who presented.
Yes.
And also, let's get the judges up here as well. Let's invite the judges up here for a group photo. Thank you so much for lending us your time and expertise.
Yep.
Let's get everybody on stage. You should hold a trophy. It's your trophy.
Please come up here.
Yeah, you should hold the trophy. Yeah. Oh, you're together. Okay, great.
Please join us here.
Okay, let's Let's all come in. Everybody in?
All right. Okay. Thank you. And I just want to ask Asai a quick question. How are you going to spend the money?
I'm not allowed to say we're going to pizza because that's not happening. No, we have a huge hole called clinical research we need to put in. So please send more money if possible.
All right, thank you very much. I would like to thank everybody. I would like to thank our partners, Extreme Tech Challenge and Novo Nordisk Foundation. I would like to thank all the finalists. I would like to thank all the judges and, of course, all of you in the audience. Please give yourself a huge hand. All right, we bring this event to a close. Remember that innovation knows no limits, and the journey doesn't end here. Life Science at TechBBQ is continuing. Keep pushing the boundaries, keep breaking the barriers, keep pursuing your dreams, and continue making a positive impact on the world. Thank you for joining us here today.
And thank you, Jan, our awesome MC for the day.
Thank you.
Thank you.